evening. Thank you very much for joining us here on Times Now. I'm Hina Gambhir. We today are living in difficult times when dreams are getting shattered, dreams are being deferred. A dozen odd days ago, as May ended, coronavirus had officially reached 190,000 people. The pandemic, fueled by greater human movement on vast unlocked stretches, has now shifted gears. Around 10,000 people every day. Strike rate has taken the COVID-19 positive cases to over 300,000. India now is one among the top worst hit nations in the world. But as a poet in a work titled Resolve has said, it looms and yet I refuse to lose this fight to it. Prime Minister Narendra Modi has been saying Indians have to turn this adversity into an opportunity to emerge as Atmanirbhar Bharat. Over the next 60 minutes in this brand new Living Room Conclave by Times Network, we are going to focus on India's health mission. What should we do to deal with this pandemic, and how should we really prepare ourselves to defeat this invisible enemy? Joining me on the show today, Dr. Randeep Guleria, Director AIMS, Mr. Venkatesh Vijay Raghavan, who is Director and CEO Kavin Care, Mr. Ajay Harinath Singh, Founder and Chairman Darwin Platform Group of Companies, Dr. Shikha Sharma, who is a well-known nutritionist, Dr. A. Velumani, CMD Thyrocare, and also Dr. D. Prabhakar, epidemiologist. Thank you very much, all of you, for joining us here on this very special show on Times Network. Dr. Velumani, let me begin this discussion with you. ICMR recently has said that India is still far away from reaching the stage 3. Community transmission is still not happening. According to your assessment, where are we on the curve today?
Unfortunately, everybody is learning, including ICMR. This pandemic is first of its kind, very unique. We did not know how to react. Everybody reacted on their own perception about this invisible enemy. According to me, India is not a single country. India is a country of countries. And I believe that Mumbai kind of metro cities, we have reached to a kind of number which may not increase really. Tier 2 cities are yet to show off. Then will be Tier 3. Then if you look at country as a whole, it is not like Italy or Germany to see it as a thing happening in our control. So having said that, I don't know how to differentiate between phase 2, phase 3, phase 4. But I am of that opinion. This infections counts will keep on increasing. Number of deaths will keep on increasing. I have a reason to believe when 1,000 people die in a day, India would have reached the maximum. When this 1,000 deaths per day will come back to 100 is not known, whether it is after a couple of months or a couple of quarters. So country is too big. And this virus is not at all mild to India, as many people have been saying. Only my perception is deaths per million still is far low compared to many other countries. But I can only hope that it doesn't reach very bad. Otherwise, the transmission wise, every state has a statement. Every, even municipality has a statement.
Right.
But I wonder how far we are right.
Okay, Dr. Velumani, clearly the situation is quite scary. Mr. Venkatesh, I want to now ask you, since Dr. Velumani mentioned about Maharashtra specifically, you know, when the number of cases started rising sharply in Maharashtra, the biggest worry for all of us was Dharavi, which is Asia's biggest slum. It had become a hotspot as well, but now it seems to be flattening the curve. And the biggest reason, sir, is sanitization. Do you think this example has proven that sanitization perhaps is no less a weapon to deal with this pandemic as compared to a mask?
Yeah, I do. I believe that sanitization is critical in this mission. While we have a global pandemic, the way to control this is not necessary yet, and we're fighting on it. Sanitization, I think, element that can overcome some of the, and I think probably getting proven in parts of the country, including Dharavi as well. While there may be many more reasons to it, sanitization definitely is one reason that I believe can help us control this menace right now. And my belief is self-hygiene is as important as public sanitization that we do today. And it's important that we as citizens practice self-hygiene a lot more and be aware of self-hygiene, control ourselves in terms of some of the social interactions that we do, and that would probably help us more.
Okay. Mr. Ajay Harinath Singh, now, since we are talking about the challenges right now that India is facing in fighting this pandemic, another key challenge is the lack of skilled staff in the healthcare sector, especially when the frontline workers are also now becoming victims. How do you see this problem and how can India really deal with it immediately?
Well, good evening, everyone. We can say we have a lot of people, skilled workers working still off the line. We are not able to get them on payrolls. We should taking them.
People, especially the nurses, the ward boys, the doctors who are unemployed. There are a lot of vacancies. Hygiene instructors, everybody should be employed. And I think there is a lot of opportunity for everybody to be taken on the board right. But people are actually not doing it. Government is actually not taking care of it. The vacancies were there from long back. We can actually go ahead and employ them right now. As these people who are working right now on the frontliners, they have shifts. I have seen people talking about that there are no doctors in the hospital. But the doctors are there. They have worked for 18 hours and 19 hours. You can't say some doctors that they're not working at all. And somebody working in the ICU has to go back home and has to go back home and has to go to a quarantine for 14 days. He doesn't have, you need a replacement. So the government has to act very strong. There are a lot many doctors who are unemployed. Hire them. They are waiting for you. There are a lot many nurses. There are professionals are waiting. Skilled laborers are waiting for you. But no, the government has to act. And it depends upon the people to people. Now, Chief Minister of Maharashtra is doing that job. I see our health minister has done a fantastic job. We have brought the numbers as per our population. We are intact, but still, we require a robust system, get people employed, and without that, we cannot move ahead.
Okay, so you expect more support from the government side clearly. Dr. Shikha Sharma, if we have to learn now to start living with this virus, considering the kind of challenges that we have discussed so far will continue to remain, what about the issue of nutrition? Do you believe that perhaps now there is a need to give advisories on nutrition as well, just like other do's and don'ts that are being given?
Yes, I think the fundamental thing which people have to remember is that our bodies have an inbuilt defense system which is in simple terms called immunity. That means the immunity is fundamentally a method by which in the body antibodies are produced against the virus, and there is a complex system which kills all kinds of viruses. Now, if you really see the deaths between people who have comorbidity and people who do not have a comorbidity, it is significantly different. I mean, so people who are not taking care of their health, who are whose blood sugars are rising, whose blood pressures are not under control, and they are not, they are having asthmatic situation, they are more at risk. So I think number one defense against any virus is that immunity has to be boosted. Now, to boost immunity, there are several things which are well researched. For example, amla is well researched, ginger is very well researched, black pepper or kali mirch is very well researched. Similarly, cinnamon, it is very well researched. Even drinking water in copper vessels, like copper glasses, because copper kills virus very quickly, unlike stainless steel or glass. So I think to boost your nutrition and to eat right. Now, when I say eat right, basically we are empowering our body to increase, when we look at vaccines, when we look at other things, What we are saying is, oh, I'm going to only depend on a vaccine coming after several months and I'm not going to take care of my health till now. Now, this is not wisdom or common sense. So I think we have to be calm, we have to use common sense, and we have to be very clear that this is not the time to binge eat, this is the time actually to eat right, which I will keep explaining on what are the things we must include in our diet.
Okay, very important point you've raised. Dr. Guleria is also now joining us in the broadcast. Dr. Guleria, I was discussing earlier with our other guest that ICMR has said that we still haven't reached the stage of community transmission. But then there are, statements coming from officials from Delhi government who seem to suggest that by July end, Delhi specifically, is going to have about 5.5 lakh cases. It's scary. What is your assessment of the pandemic, sir?
So I think there are two parts of this. One issue is regarding community transmission. If you look at the data which ICMR showed, although this is from 30th April, but the prevalence of COVID in the entire country is not that high. And therefore, if we say there is community transmission happening in the whole country, that would not be a correct statement. However, we have the so-called hotspots, especially in metropolitan cities, where the number of cases are rising. And it is definitely true that there is a likelihood that local community transmission is happening in these areas, and that is why the number of cases are rising. If we need to work to decrease this, we will have to develop a specific strategy as far as these hotspots are concerned in terms of management, in terms of containment, and in terms of what we can do. I think that is very important.
Okay, and so many are also saying that there is a significant shortage of beds in the country. Why is it now that the work has started on improving the health infrastructure when we are in the middle of a pandemic? Do you think perhaps that is another disadvantage with a country like India?
So I don't think that the work has just started now. As a matter of fact, one of the advantages that we had of the lockdown was that the curve did not rise that steeply, and it gave us about 6 to 8 weeks to really work on building facilities. And two things that we realized based on what was coming out from data from our country. One is that our population is not that critically ill as what we were seeing in Italy and the US. Our mortality rates are lower. Secondly, one of the most important things that we will need for our sick patients would be oxygen therapy. So there has been this whole focus on building COVID care centers, COVID hospitals, with oxygen available, and the COVID ICUs where ventilatory support is available. However, when we start looking at individual cities, the population density there is so much that there has to be a comprehensive planning there, because there the ratio is totally different from what you would see in other parts of the country. And therefore, we need to really see that as things start peaking in a particular city, how can we suddenly upscale our facilities, whether it be looking at constructing temporary hospitals or developing other strategies, because a large number of our patients have mild illness. At AIIMS, we have now close to 800 patients admitted, and we are now looking at strategies where we can send them home early if they are stable, only admit those who really need to be admitted, and encourage patients to be at home and develop a system of teleconsultation, and so that you can follow them up regularly at home, but they don't need to come to hospital. At the same time, they feel that it's not that they've been sort of left abandoned, and they are being followed regularly for any symptoms. And if they have any problem, they can immediately come to the hospital for admission. So one will have to develop outside the box strategies for this increasing number. But I think a lot of things need to be planned urgently because of the fact that the numbers are rising significantly in many of the metropolitan cities.
Two important points you've raised, Dr. Guleria. Out of the box strategies, need of the hour, need to plan things urgently. Dr. Prabhakaran, what do you suggest? Because our cases are rising by about 10,000 new cases per day, and India is moving up the ladder of the worst affected COVID countries in the world. It is not something that we can really be proud of.
Right. Thank you, Hina, for having me on this show. I just want to put a few things in perspective. First is the annual number of deaths in India is close to 10 million or 1 crore. So given that, if you calculate it on a per day basis, it's around 25,000 deaths per day all across India. And a large majority of those deaths are related to non-communicable diseases, particularly cardiovascular disease, cancer, and so on. So I'll come to that point because that's important, that we need to keep a focus on that. And we need to destigmatize this particular disease, as what Dr. Guleria said, that there are a lot more milder cases who can be treated at home. So in terms of what we need to do, is I think there are a few things that people have already started doing. One is the use of telemedicine or a telehealth platform in taking care of people. But there is a problem of inequity there, because in rural areas and people who do not have such facilities, what can we do? So there one could think of what we call as role delegation or task shifting, and train community health workers actually to contact these people and help them in terms of contacting the hospitals or their healthcare providers. Then the second problem that arises with for people is, how do we distribute drugs to them? How do we get the medicines to them? So I think we require some kind of out-of-the-box thinking again in terms of giving some kind of novel supply chain mechanisms to get drugs to them. The third is, how do you triage people when they come? How do you actually, get people, there are these COVID centers, there are these COVID hospitals, but many hospitals are non-COVID. How do we really triage and identify those people with COVID and those people who have an emergency which is non-COVID? So I think we require some mechanisms for that. I'll come back about other things, like, for example, as we move along, if there is going to be a second wave later on, how do we include NCDs in the protocol, in the emergency protocol? These are some of the things we need to think through and address.
Okay, those are very important points you've raised, and in a way they give us a sense of, the solutions that perhaps we can consider going forward. Dr. Velumani, now, there is going to be a requirement of participation from the private sector as well in a big way. How do you think private sector can really help in dealing with this situation along with the government? Because government has been working overtime. Now support is needed from other stakeholders as well.
I think private has been in, and private has been actively in both laboratories and hospitals for the last 40, 50 days. In fact, what I see is we don't have adequate preparedness in quantum wise how to accommodate those who are severely ill. And to add to that, the panic has made people to search for hospitals even before things becomes worse. And the number of beds available in the country, for the size of the country, for the size of the number of patients who may need it, that is the biggest alarming situation. If I know, if I have to go to a hospital and the hospital beds are not free, I am not worried about the disease as much as I am worried about the treatment I might get once I land in the gate of the hospital. Having said that, this virus is not going to spare anyone. Entire world population has to come under exposure. I don't think Indians can escape the exposure. Indians could have less infected per million because Indians are believed to have a better immunity. And Indians are less deaths per million because Indians have so far shown less deaths per million, will continue to do so. But 135 crores, even if the deaths per million is too little, you have too many in counts and you have to have facilities. And I believe private has been very much actively inside. But let me tell you the problem of the private. The healthcare workers who are forced to do work in COVID feel very, very disappointed, very, very frustrated because the number of hours they have to work and they have to work with the TPE on entire day. On the top of it, a lot of pressure of the management percolates down in the pyramid to the frontline workers. So management have pressure because there are cost pressures, there are time pressures, and there is a fear pressures, pandemic pressures. So it is not that easy to tell that somebody is not cooperating. All government is working 300% of their capacity. All private is working 200% of the capacity. It is the virus which is not sleeping. We have to sleep at least minimum 6-7 hours. It is overtaking us. So we need to find out how best people can be motivated. Private needs to be motivated. Private cannot be kept on firing every now and then. And a private hospital owner cannot keep on firing his healthcare workers for not helping him to avoid what you call as disciplinary action. Let us put it this way. An employee's productivity goes 10 times high when he is motivated.
Yes.
So is a private. If you motivate the private will do a lot of work.
Okay, so your view is there is a need to, perhaps be more proactive and seek participation from the private sector. They need to be motivated. We've discussed the challenges broadly. On the other side of this very short break, we will be talking about solutions. And I would like to begin with you, Dr. Guleria, when we come back after the break, and we'll talk about solutions. How can we start learning to live with this virus? What kind of changes do we need to bring in our life? Because it is going to be here for at least some more time. We'll be back on this after this very short break. Stay with us. Welcome back. You're watching Living Room Conclave on Times Now, and we have an eminent panel of guests with us, and we are discussing the way ahead as far as this fight against coronavirus pandemic is concerned. What is it that we should now be doing in our lives to deal with this crisis, because it is going to stay here for some more time at least. Mr. Ajay Harinath Singh, I want to ask you, as you heard some of our guests trying to suggest that, perhaps we need out-of-the-box strategies, we need to do more to help Indians deal with this crisis. In your field, how do you think you can contribute? You've been a philanthropist as well. Are philanthropists, doing enough in this regard? Okay, I think there's some problem with the audio line out there. We'll try and reconnect and get back Mr. Ajay Harinath Singh as well on the discussion. Meanwhile, Dr. Guleria, as we have discussed the challenges already, I want to focus on what next from here on. There is going to be a requirement of a large number of beds with the way cases are rising. Are we prepared, sir, to deal with this?
So we are working, it's like a strategy that you work with as the pandemic progresses. And like I said, one had done a lot of work. The government had worked on creating what we call COVID care centers, COVID hospitals, COVID ICUs. But a lot depends on the numbers that rise, and the strategy will have to evolve as the numbers change. And remember, these are areas which are different. The whole country will behave in a different manner. Cities are behaving differently, small towns will behave different, rural India will behave in a different manner. Currently, majority of the cases that we are seeing, almost 70 to 80% of cases, are coming from metropolitan cities. And therefore, there is a need to have extensive planning, both in terms of how do we decrease the number of cases there, and secondly, what can we do in terms of increasing the health infrastructure. And as has been rightly said, there has to be a public-private partnership. There has to be incentives for the healthcare workers to be able to work in the COVID care, COVID centers and look after COVID patients. It's a challenging time for everyone, and I think everyone has to really come forward to really help in saving lives. The most important thing I think currently is not the numbers, but how we can keep our mortality down and how we can actually save lives.
Okay, fatality rate in fact is quite low as compared to other countries. But Dr. Guleria, do you believe that there is also a need to perhaps relook at our testing strategy? We know number of tests per day have gone up tremendously, but one of the reasons why New Zealand has been able to remove coronavirus from its territory completely is because of mass testing.
So I agree with that. I think there is a need to, our testing strategy has to evolve. It has to be based on two things. What is the question that we want to answer, and therefore test accordingly, and to see whether we have the capacity for what we want to do. We started off with only about 10 to 20,000 tests a day. We are now doing almost 1.5 lakh tests a day. Started off with very limited labs. We have now more than 800 labs, and that is growing, which can do testing for COVID-19. And therefore the capacity has increased tremendously. I do agree, as the capacity increases, we become more open, so that especially in the hotspots or in the areas where the number of cases are rising, we're able to really detect cases early, be able to isolate them, and thereby prevent the transmission of disease and thereby decrease the number of cases. So testing is an important strategy which needs to evolve and be possibly slightly different in areas where you're having the hotspots as compared to the rest of the country.
Okay, focus on hotspots, re-look at the testing strategy is something that you believe is the need of the hour. Mr. Ajay Harinath Singh, I was asking you, as Dr. Guleria also mentioned just now, that it is going to be important to have participation from the private sector, from all possible stakeholders to help Indians fight with this crisis. How do you think philanthropists can really help in this case?
Well, everybody is going down the line to help everyone. And I think the media has covered every single part of it. Still, we can go up to micromanagement by going to the lowest level, keeping a health instructor in every district, every Zilla Parishad Panchayat, every village. And every health instructor can actually sanitize the area, take the ownership on the payrolls of the government or the private companies or the private health industry organization. We can make a difference in a very small manner and a much faster manner. This can be done in a robust manner if implemented by the government and the private players parallel.
Okay. Dr. Prabhakaran, what kind of backroom work really are the epidemiologists doing at this point in time, considering that, with over 3 lakh cases, we have got a fair idea about, how this virus is moving from one place to the other in the kind of age groups that it is targeting right now. So what is it that you are going to advise, sir?
So I think as an epidemiologist, we need to focus on three things basically. When we look at an epidemic, there are 3 aspects to the epidemic. One is the host, the second is the agent, and third is the environment. So we need to tackle all the 3 so that we come up trumps at the end of this epidemic or pandemic, as you want to call it. So one of the advice is social distancing, masks, which are very important. But as the pandemic progresses, newer challenges come up. Identification of new problems, new symptoms. Like today, for example, the government said that loss of taste and loss of smell should be an important symptom. So we should be nimble enough to identify those new things that emerge and include them in our management protocols. The second thing is, it is important to protect the elderly. It is important to protect people who have comorbid conditions such as hypertension, diabetes, or cancer. And therefore, a process of what we call as reverse quarantine should be considered, where the younger people go out and work, because obviously we cannot lock down, or we cannot keep on saying that people should work from home or not come out at all. So the younger people have to go out. They may get the infection and come back home, but we need to protect the elderly people in the houses. And so we need strategies there. Something like a reverse quarantine is an important mechanism by which they're protected. One argument would be, how do you do it where there are crowded people, where in a room there are 3 or 4 or 5 or 6 people living together? How do you manage? So there again, you require some out-of-the-box solutions to get the older people into a different place as compared to the younger people. Some kind of strategy like that needs to be done. In terms of caring for patients, I think remote monitoring, telehealth, and those strategies that we discussed are extremely important. In terms of the host, that is the patient themselves, improving immunity, as what Dr. Shikha said, or maintaining the lifestyle. I mean, if you're a smoker, avoid smoking. If you consume alcohol, avoid consume alcohol. Those are the kind of simple things that can be done to reduce your risk of getting the illness.
Okay.
Even if you get it, you can manage it better.
Okay. Dr. Guleria, as we were talking about how this virus is impacting people of different age groups differently, and as per the latest lockdown norms that are in place, as we are in the middle of Unlock 1.0, as many are calling it, there is an advisory, especially for elderly and for kids below 10 years of age, to stay indoors. But what the data now is suggesting, that as people have started coming out of their homes, fatality rate among those people of age group between 30 to 50 is also increasing.
So I think this is a relative thing. It's increasing predominantly because we've been able to keep the elderly out. But if you look at the global data, it does suggest that those with comorbidities and those who are over the age of 60 and 70 are definitely at a much higher risk. And therefore, if we need to keep our case fatality rate down, our mortality down, we have to be able to protect the high risk groups, because if they get infected, as happened in many nursing homes abroad, the mortality will really shoot up, and that's why our mortality is relatively low. Therefore, when we are talking of strategies, the strategy is not only to decrease the number of cases, the strategy is to protect those who are at a higher risk of getting serious illness and are dying because of COVID-19. And therefore, we need to develop strategies. It could be getting healthcare workers, NCC people, or the RAW of the colonies to get involved in trying to see how can we protect the elderly, support them, and see that they don't have to go out when it comes to some need, whether it's going to the bank or it's going to the market. Because if we are able to protect them and take necessary steps, we will continue to be able to keep our mortality as low as it is right now.
Okay, and on the issue of testing as well, before I go across to Dr. Velamani, I have one more question for Dr. Guleria. Dr. Guleria, do you believe that perhaps random testing is something that is the need of the hour as well at this point in time, with the movement of people now increasing, more and more relaxations kicking in, economic activity has to be started as well? So do you believe random testing is something that the country should now focus on, apart from focusing on the hotspots?
No, I don't think random testing is the answer, for the simple reason that unless you test people who have high risk contacts or who have ILI and you start testing everyone, it doesn't give you assurance that this person will not become positive 5 days later. So if you start testing people randomly for whether they have COVID-19, it doesn't mean that he will not get COVID-19 a week or 10 days later. So there are two strategies. One is testing people who have symptoms or who have come in close contact and therefore are likely to have symptoms but are asymptomatic. And the second is to see what is the population which may have had the disease, which is what is known as serosurveillance. That is, you test the individuals based on sample size to see for how many of them have antibodies. And if they have antibodies, that means they have been infected, were asymptomatic and have recovered. So your strategy for serosurveillance in various areas has to be different, because there you're trying to see how many were asymptomatic and got infected. But when it comes to treatment strategy, it will have to be done for those who are at high risk of getting the infection, either those who have come in close contact with a COVID positive patient, maybe asymptomatic, or those who have classical symptoms which suggest that they could be infected with COVID-19 and therefore need to be tested and isolated. Random testing, in my mind, would be a waste of our resources, and it will not really give you any protection, because it's a one-point test. It doesn't tell you what can happen 5 days later, 10 days later, or 2 weeks later. So you will have to be more focused as far as your testing is concerned.
Okay, you need to be more focused. Dr. Velamani, Thyrocare, I believe, was the first lab to get this clearance from ICMR to conduct the tests. Can you tell us how much have you been able to expand your capacity, especially via a van that can go into rural areas specifically and help us fight with coronavirus?
We have not truly gone rural. We are in Navi Mumbai. We have covered only a 300-kilometer radius. Beyond that, logistically, it's not that simple to cover. We started with 500 tests per day capacity. Today, we are around 5,000 tests per day capacity. So the capacity has been significantly ramped up. All private players have ramped up. But having said that, today we know probably with some kind of approximation how many are dead among the infected, because we test and then we call infected, and then when they die we call percentage death in the infected.
Okay.
But we don't know what is the percentage infected out of the exposed, because exposed only then becomes infected. So some may not have got infected because they had a high immunity. So this antibody test has been awaited and now it is almost ready. And government has to get going on it to see how many got exposed and what is yet to get exposed. Until this, we don't know whether we are reaching near to the peak or the peak is too far. Number two, you are not going to get a reprieve too soon. You need to create bed capacity to manage that many deaths per day or deaths per million. Like how earlier colleague in this panel told, 25,000 people are dying each day because of non-COVID illnesses. And we are sitting with COVID only focus. I'm not telling COVID is not important. How long are you going to ignore the non-COVID patients? So you need to segregate facilities, not 80%, 20% of a hospital is non-COVID and COVID. You have to have 50% hospitals only for COVID. You have to have 50% only for non-COVID, and plan in a long run and create infrastructure, create motivation, make people. You need to pay salaries to the employees. You need to motivate the healthcare workers. A lot of money has to be spent on healthcare to come out of it. It is not going to be just, यूं ही हो जाएगा. When we were told 21 days, if you sit at home, then we will be getting rid of this menace. How many lockdowns are over? Even 21 lockdowns cannot sort out without adequately pumping in funds into healthcare as a sector. Please infuse sufficient money. Please motivate the entire healthcare, working, non-working, retired, still studying, nurses, paramedical, everyone. There is a solution. That is the only way, and it has to go through that.
Very interesting. In fact, Mr. Venkatesh, clearly all the people, all the stakeholders have to come together to help India defeat this invisible enemy, as we've been calling it, coronavirus pandemic. And sanitization has emerged as a very crucial weapon. What should be the sanitization levels, according to you, in the country, like we are talking about testing levels in the country?
So as one of the eminent panelists were talking about, I think the testing strategy depends on what question are we trying to answer. Probably rather than looking at it that way, I would probably look at it from a perspective of saying, what can sanitization help us do, or what can sanitization help us avoid in this whole game, as a lot more of people work on the administrative side to bring things under control. So my view, I think, is two things, as I said. One is, of course, personal hygiene. And the second one, I think, is sanitization, I think, plays a very big role in terms of being able to the limited knowledge of the common man that I have, sanitization brings in a lot more ability to control at least future risks that we carry with us. Now, that could be on public sanitization, that could be on private, at your home.
Okay.
But my belief is that that's a very important part of the game. And I look at it as what can the common man do? What can the administration do? While a lot of discussions definitely would happen around the administrative side, I think as common men, as common people, there are certain things that we would probably need to look at so that we could do our bit to help in this scenario. And
yes,
in my view, sanitization is one of them. And of course, the other one that one of our panelists talked about is immunity. I think there are two things that as common people, if we were to look at it, that would be of help, definitely to at least tide over a bit on this crisis that we have today.
So personal hygiene is going to be very, very important. Apart from that, immunity is going to be very critical as well. We're slipping into a very short break, but when we return, we'll talk to Dr. Shikha Sharma about how to boost immunity at this point in time when we are in the middle of this pandemic. We'll be back after this very short break. Stay with us. Welcome back on Darwin Group presents India Health Mission, powered by Bacto-V and associate sponsor Herbalife and Newberg Diagnostics. We are talking about how to live with coronavirus. What kind of changes can we make in our lives to ensure that we remain protected? Dr. Shikha Sharma, now this pandemic clearly has made all of us extremely conscious and cautious about our immunity. In the beginning, you also told us about the things that we should really be doing. People tell us what we should do, but what is it that we should not do? What is it that we should completely stay away from?
I think that's a wonderful question, and very quickly I want to just point out that a lot of people are getting confused. They are thinking that infection is equal to death. In the lay people are thinking, oh, if I'm infected, they immediately imagine ventilators and death. And that needs to be, this myth needs to be broken, that the mortality rate in coronavirus is quite low, and that is fundamentally the X factor, the hidden factor is the human immunity. And that is the saving grace for any human being, that if they improve that X factor, which is their own immunity, automatically the mortality will fall even lower. Now, having said that, what are the things we should not do? Number one, I think To build immunity, our liver and our intestine have to be very healthy, which means that we should not have too much of fried food and all these refined oils, because a lot of people unfortunately have got into an overdrive of cooking fancy things. So that is not recommended. Second thing is, of course, smoking, tobacco, and using in the homes people are using a lot of chemical sprays to clean and do stuff. I would really recommend, please do not use any chemical sprays, because that would have a negative impact on your own lungs. Because when we use pesticide, when we are using like for termite control and all that, please stop all that right now. Do it much later when when your lungs can handle it. Number 3, which is equally important, is what are we doing in terms of boosting our multivitamin intake. For example, vitamin C needs to be taken in bigger doses, and we can take, of course, natural sources of vitamin C, which is amla, which is an excellent source. We can even use some of the recipes which are being published by Ayush and many government departments, which have dalchini, which have ginger, which have turmeric. Turmeric has emerged as one of a wonderful fight against many viruses, and I'm sure this will help against this virus too. Third thing which is also very important is that I think it is very important to start having a lot of vegetables and fruits. Now, people are worried that if they have vegetables and fruits, the virus might come in through that. Firstly, when you are cooking vegetables, there is no virus which can survive cooking. And secondly, what is very important is that when you are getting vegetables and fruits and you are putting it in the baking soda, you are putting a little bit of baking soda and rinsing your vegetables and fruits with that, and then rinsing off the water well, that itself will protect you from any infection from outside. But it does not mean that people will stop eating vegetables and fruits, because that has sources of vitamin C and vitamin B complex A. Now, one more thing which is important is, as people are living indoors, they have completely stopped sun exposure, and there has been enough research showing that vitamin D deficiency is itself a risk factor for getting infected and it becoming serious.
Okay.
So my request is, please do not do not avoid sun to that level, and do get your vitamin D in adequate amounts. For people who already are very low in vitamin D, I would definitely advise supplementation with vitamin D. So these are the things which, like I said, the hidden factor, the X factor, which means that even if you get infected, if your your immunity is high, the mortality is going to be very low, and it is
that's a very important piece of advice, Dr. Shikha Sharma, that you've given to our viewers today. Now, I also want to ask my other panelists as well, very quickly, what is that one piece of advice they will like to give to our viewers? How can we protect ourselves? How can we start learning to live in this kind of a pandemic? Let me begin with you, Mr. Ajay Harinath Singh. You won the Global Indian of the Award as well last year. What is going to be your piece of advice as India is now trying to learn to live with it?
The slogan should be like, "Swasth chale, ghar chale." Because अगर हम स्वस्थ हैं तो हम घर पे सही रहेंगे, and probably everybody should be hygienic enough. So there should not be, the piece of advice is like, take care of your family. जान है जहान है, मोदी जी ने जो कहा है, but still स्वस्थ चलना बहुत important है. That's the slogan I can give.
Okay, Mr. Venkatesh, what is your last word?
So my last word, I think, let's not forget our Indian traditions. I'm a firm believer that Indian traditions of the past, current, have a lot of solutions to what we are talking about as personal hygiene and immunity. We call them kitchen recipes today, but I think they are far more than just recipes. They have a huge amount of knowledge bank that can help us self-protect ourselves. So let's stay safe, stay secure, but I think let's go back to our roots. That would be my message. While yes, my salute to all the warriors in the front who are actually toiling their work out to help us be safe and secure.
Dr. Prabhakaran, what's your last word?
I think I would emphasize the three basic things: the mask, that's very important, social distancing, and of course hand washing and personal hygiene. And in terms of the diet, rightly pointed out, we have to have a balanced diet full of fruits and vegetables, and a colorful diet. Avoid tobacco avoid tobacco completely, avoid alcohol as much as possible, but if you drink in moderation. and wait for the vaccine and the drug trials to come up and sort out the problem.
Okay, so sanitizer should have the alcohol in the right quantity, but otherwise it should be avoided. That's your piece of advice. Dr. Velumini, I give you the last word.
Yeah, actually, India is going to have less death per million. Today, India is around 5 deaths per million, whereas some of the Western cousins are at 300 deaths per million. It is not that it is yesterday, we have finished some 150 days the journey. India also will grow in deaths per million to roughly around 20 or 30 per million, but certainly not more than 100 per million like what has happened. So that is one thing we can feel little relaxed about, number one. Number two, I think it is very simple, as the earlier panelist was talking, immunity plays a very great role. If you have high immunity, you will not know that you got exposed. And if you have an average immunity, you will come to know that you are infected. And if you have a low immunity, afterwards you have to get into the hospital and you can come back. And if you have no immunity, you have to go.
Okay.
So take care. Immunity plays a very huge role in defending yourself. Government cannot save you nothing. It is your immunity which only can save you.
Yes, you have to take care of yourself. That's the message. And thank you very much, all of you, for joining us on this very special show. This was only one part of this India Health Mission that we will continue over the next couple of weeks. More on what you should do, what you can do, and other aspects will be explored next week, same time. Thank you for watching.